So today I'll be discussing what I call indication for ulcer testing. How do I know I need that ulcer test? So if you're in that category of patients that consistently have abdominal pain, burning sensation in your abdomen that comes between meal or after meal or at night and gets worse, especially when you're hungry, there's an indication for an ulcer test. If you feel nauseated, bloated, or vomiting, there's a need for ulcer test. If you have that unexplainable weight loss, you notice that you're losing weight unnecessarily, there's also a need for an ulcer test. And if you're vomiting blood and stooling black colored stool, there's an indication for ulcer test. Maybe there's an internal bleeding somewhere. If you're on prolonged medication of non-steroid anti-inflammatory drugs like diclofenac, ibuprofen, and so many others, this can also be a risk factor to having this ulcer pains. There's a need for ulcer pain. If you have what we call the H. pylori bacteria, this can also be a risk factor to developing those ulcers. So when next you have all these symptoms, kindly discuss with your medical personnel, which is going to refer you to do some series of tests to rule out all these ulcer signs. I remain yours sincerely. Join me in my next video when we'll be discussing the different diagnostic tests to rule out these ulcer symptoms. I remain yours sincerely. Thank you.